All right, so let's talk about pathology. So first of all, let's talk about what a pathologist is. A pathologist is a medical doctor who studies and diagnoses disease in humans. And a pathologist doesn't have to work with dead people. In fact, a regular pathologist doesn't work with dead people. A regular pathologist is just working with people who are sick. They might work with people who have malaria. They might work with people who have the flu. They might work with people who have cancer. A pathologist is somebody who is studying and looking at the diseases in humans. A forensic pathologist is the one who's going to work with dead people. The forensic pathologist studies the trauma that leads to the death of an individual. So there's a difference between just a regular pathologist and a forensic pathologist. The forensic pathologist is going to use something called an autopsy. And what an autopsy is it's a standardized dissection of a corpse in order to determine the cause and the manner of death. So we will talk more about the cause and the manner of death more specifically. But the two main goals in an autopsy are you want to figure out the cause and the manner of death. There are other goals to an autopsy, but these are the biggies, the cause and the manner of death. So the cause of death is divided into the primary and the secondary causes of death. The primary cause of death is the immediate cause of death. It's the thing that really caused that person to die. So it's what we would say is a 3-link causal chain. Now, 3 is sort of general. It could be 1, it could be 4, but 3-ish. So we say a 3-ish link causal chain. So it's a chain of events that explains what happened to cause that person to die, the cessation of life. That's a fancy way of saying what caused that person to die. And it starts with the most recent condition. So we start with the most recent thing and then work our way back. So here's the most recent condition. It's due to this thing and the next oldest condition, and then that's due to this other thing. And you might go back 4 links, or you might not need any links at all. So a gunshot wound is just a gunshot wound, but a heart attack might have some previous causes that are going to, be relevant. So I'll show you some examples of that. The secondary cause of death includes conditions that are not related to the primary cause of death, but do contribute substantially to the individual's demise. So things that didn't directly cause the person to die, but they certainly didn't help any. They certainly did not make matters any better. So they kind of, exacerbated the situation. So let's take a look at some examples of causes of death. And the thing we want to do is we want to make sure that we do not confuse cause of death with the mechanism of death. And the mechanism of death is the actual thing that was going on in the body. And it's really, 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 really hard to understand the difference between mechanism and cause of death. And it's so hard that medical examiners talk about this, all over the place to each other, trying to convince each other, hey, this thing is a mechanism of death. It's not a cause of death. This is what a real cause of death looks like. There are all kinds of documents out there for medical examiners to help them learn what the difference is between the two. So I'll show you some examples of those. So figuring out the difference between cause of death and mechanism of death is so complicated that the CDC and the National Association of Medical Examiners and all these places have had to come up with different ways of getting the word out that certain things count and certain things don't count in cause of death. And there are very specific ways of formatting. So this is a document that was produced by the CDC to help people figure this out. So we'll look at an appropriately written cause of death here. And you can see up here we have the primary cause of death. And the first event was, or not the first event, sorry, the most recent event was the rupture of the myocardium. And that happened within minutes of the person dying. So minutes before the person died, there was a rupture of the myocardium. Well, what does that mean? Those are fancy words. So rupture means breaking or tearing. Myo means muscle. Cardio means heart. So myocardium is heart muscle. So there's a rupture of the heart muscle. Well, we're not just sitting around and all of a sudden our heart muscle ruptures. There's a reason that that happens. So why did that happen? Well, that happened because 6 days ago, this person had an acute myocardial infarction. What that means is that there was a stopping of oxygen getting to that person's heart. So the heart muscle was not getting oxygen. Basically, this is a heart attack, okay? So there's not oxygen getting to the heart muscle. That's going to weaken the heart muscle, and then the heart muscle can rupture. Well, why did this person have the acute myocardial infarction? Well, that's because 5 years ago, they had coronary artery thrombosis. So the coronary artery thrombosis basically just means that there is kind of a blood clot that is in a place where it doesn't belong. It's in this case, in a coronary artery. Coronary arteries are the arteries that are specifically there to give oxygenated blood to the heart, not the arteries that are taking blood away from the heart to go give blood to the rest of the body, but the arteries that are there that are helping out giving blood to the heart itself. Okay, so a clot there is a problem because that means you're not getting as much blood there. If you're not getting as much blood there, you're not getting as much oxygen there. Your then heart muscles are going to be without oxygen, which means then the myocardium can rupture. Well, why did that happen? Well, another thing that didn't help things was that 7 years ago, this person had atherosclerotic coronary artery disease. What that basically means is that their coronary arteries were getting hardened. So they had hardened arteries that then ended up blocked, that ended up keeping oxygen from getting to the myocardium, and then the myocardium ruptured. That's what caused this person to die. Now, what did not help at all was that this person was diabetic. In addition to being diabetic, this person had COPD, chronic obstructive pulmonary disease, and this person was a smoker. So this person had a lot going on to help contribute to her death. Moving down here to this other example, you'll see this person had acute renal failure, which means their kidneys failed like in a huge and major way. And that happened about 5 days ago. So they were able to live for about 5 days. But 8 weeks ago, this person went into a hyperosmolar non-ketotic coma. So this person went into a coma 8 weeks ago, and then it took until 5 days ago for this person's kidneys to fail. 15 years ago, this person was diagnosed with diabetes, and that diabetes is what led to the coma, and that coma is what led to the renal failure. So we have our primary cause of death here. This person didn't have a secondary cause of death, and there is not always a secondary cause of death. The other interesting thing about this document, if we scroll way down, is that it will show us some very common mechanisms of death that are often confused for causes of death. So none of these things count as the cause of death. These are processes that are happening in the body, and these processes that are happening in the body need to be explained by what's going on. So if we look at exsanguination is, X means out, sang means blood, so exsanguination is bleeding out. So that means all the blood left your body. Well, okay, but again, we're not sitting around and all the blood leaves our body. Why did that happen? What made the blood leave our body? What was the thing that caused that to happen? Another thing that we need to know about that people like to say is respiratory arrest. Well, respiratory arrest just means you stopped breathing. Well, we know you stopped breathing because you're dead. So respiratory arrest is not enough information. Cardiac arrest. Well, the definition of being dead is that your heart has stopped. So cardiac arrest, we're going to need more information. You can't just go with that and be like, hey, here we are, we're done. Old age. Nobody dies of old age. Old age is not a thing that you die of. Something in your body broke that caused you to stop being alive. What was it? It wasn't just that you got old. Something happened. There was some cause. So this is interesting. I don't expect for you guys to be super duper geniuses about mechanism versus cause of death. Obviously, people who are trained and do years and years and years of school still struggle with it. You should know the big ones. Like you should know that exsanguination, you should know cardiac arrest and respiratory arrest. You should know that those aren't valid causes of death. Those are mechanisms of death or definitions of death. So those are the ones that you need to know. Okay, so just as a point of clarification, a medico-legal autopsy, that fancy word medico-legal, it has two parts, medical and legal, is performed when there's a medical investigation of a death for legal purposes. So if we're looking into a death and the law is involved, then that's a medico-legal autopsy. There are autopsies that are performed without the law being involved. Just if somebody's in the hospital and the hospital decides that they need more information about this person's death, they can do an autopsy, and it's not a medico-legal autopsy. So a medico-legal autopsy is just if we're investigating a death for legal purposes. In that case, we're going to need to determine what the manner of death is. Actually, in any case, we're going to need to determine the manner of death. But most of the time, death is going to be natural. But if we're doing a medical legal autopsy, we have to determine the manner of death, and it's going to be one of these. It could be a homicide, which is basically death caused by another person. It could be a suicide, which is basically death caused by the self, accidental, natural, and undetermined. Now, accidental gets a little dicey because sometimes it's really hard to tell if something was an accident or a suicide, or if something was an accident or a homicide. They will stick with undetermined if they are still in the midst of an investigation, or if their investigation just hasn't been able to turn up enough information. So sometimes cases will sit and the person's death will be undetermined forever because there is no way to decide, yes, this was definitely a homicide, yes, this was definitely a suicide. In the investigation aspect, I once went to a conference where the sheriff said, you know, there are no suicides in my county. As far as I'm concerned, there are no suicides in this county. And what he meant was, if I show up at a crime scene, I'm not treating it as a suicide. Because if I treat it as a suicide, I'm probably going to leave evidence behind that might be useful later. I would rather collect too much evidence. I would rather process this as though it's a homicide and collect too much evidence than release the scene and find out later, oh no, I wish I had picked up these things. So that is up to the medical examiner or the coroner ultimately to determine. So remember I said that there were more purposes to the autopsy. So yes, we need to establish the cause and the manner of death, but then some other things that we need to do are we need to identify the deceased. We need to identify who the dead person is. We need to establish the time of death, and we need to collect evidence surrounding the death if at all possible. What's interesting in the autopsy identifying the deceased is that one coroner told me that they don't do that viewing anymore, where they have somebody come in and look at the person who's dead and say, yes, that's my brother, yes, that's my sister, yes, that's my friend, whatever, because too many people were wrong, which is really weird and trippy, but our brain does weird things to us. And so there were people who would come in and they would be so worked up and so upset and so convinced that this was going to be their loved one that they would say, yes, that's him, or yes, that's her, but it really wasn't. On the flip side, there were people who were so much in denial that it couldn't possibly be their person, that they would say, no, this isn't my person. And so now they'll take fingerprints, or they'll do DNA, or they'll do dental records. They'll do what they can. They might do a viewing for an initial identification and then do a follow-up later with fingerprinting. So coroners and medical examiners, what's the difference? Well, either way, whoever you're talking about, the position of coroner and medical examiner has evolved so that we've got the investigation of unusual, untimely, or suspicious deaths. So if there's a need to figure out what's going on because this happened in a way we weren't expecting, at a time we weren't expecting, there's something hinky about it, then the coroner or the medical examiner is going to be called in. So a coroner can be appointed or they can be elected. Usually a coroner is an elected office, and no formal education or medical training is required. You do not have to have any kind of formal medical training to be a coroner. All you have to be is elected. So in most counties, you can be 18, and if you're 18, you can run for office, and that's it. If you fill out whatever necessary paperwork there is and you get enough votes, you can go be the coroner. So if you are really excited about being coroner, go ahead and launch a campaign and see if you can go be the coroner in Lake County or McHenry County or any of our surrounding counties. You don't actually need any qualifications. Now, it's obviously great if you do. Now, this seems a little sketchy, but if you think about it, if you're in a really rural area where there aren't that many murders, where there aren't that many suspicious deaths, you don't need somebody who has been super highly trained and this is their job, because they're only going to work once or twice a year, and we're not going to pay somebody to do that. So a lot of times in the rural jurisdictions, it'll be like the local mortician, the person who runs the funeral home, or it'll be the sheriff who is also the coroner, because they're certifying the deaths. They can always call in a forensic pathologist to help them out to do the actual autopsy, and then the coroner just signs off on the paperwork. The alternative to a coroner is a medical examiner, and a medical examiner is typically appointed. That's somebody who's got to apply for a job, they've got to be hired, they've got to be assigned to this position. They're usually a physician, a doctor who has gone through 4 years of university, then 4 years of med school, then 4 years of their basic pathology training, and then an additional 1 to 2 years of forensic pathology training. So if you're going to be a medical examiner, it's going to take a lot of training to get one of those jobs. Different jurisdictions have different systems. Illinois has a combined system. So Cook County has a medical examiner system. The rest of the counties in Illinois have coroners. So we've got this combined system in Illinois, but there are some states where there is just a medical examiner system for the entire state. For example, Virginia. And then there's a chief medical examiner for the entire Commonwealth. And they are over all of the different medical examiners in the state. So it just depends on where you live and what your state has decided to do. All right, moving into the postmortem examination. Postmortem is just a fancy way of saying after death. Post means after, mortem means death. So the postmortem examination, or the autopsy, starts with an external examination of the body. You're going to start with their clothing. You're going to describe it. You're going to photograph it. You're going to take notes, just like everything else we've done in forensic science. Lots of photography, lots of note taking. Do some sketching. Once you've got the clothing off the body, you're going to take it over to a place where you've got a bunch of butcher paper spread out. It's going to be just like when we did that Locard's Principle lab with the white t-shirt, and you're going to go over it with a magnifier and look for any kind of evidence that might be useful to you. Then you'll go over to the body, and you're going to do the same thing. You'll go over it with a magnifier. Some things you're not going to need. You know, if there's big trauma, if there are cuts, lesions, bruises, things like that, you're not going to need the magnifier. But then you are going to want to go over it with the magnifier to look for tinier things, for trace evidence that's left on the body, tiny cuts, puncture holes, things like that. If you find any trauma on the body, you're going to mark it onto a diagram like this one over here. And these are pre-made. It doesn't matter if your person is fatter or skinnier. This is good enough. Everybody can understand. So if there's a tattoo, you might want to mark that there's a tattoo here. If the person has a cut or a laceration, you're going to mark that there's a cut or a laceration. Any kind of trauma is going to get noted. And then notice there are also just notes in words that are getting written down. You want to make sure that you're preserving any trace evidence. As I said, you're going to want to submit that to the forensic science laboratory later. Determine the person's age to the best of your ability, their sex, their ancestry, their height, their weight, state of nourishment, meaning are they obese, are they undernourished, are there any birth-related abnormalities, do they have, you know, an extra thumb, do they have one leg longer than the other, do they have birthmarks, is there anything going on there? And then you're going to look for death-related phenomena. Death-related phenomena meaning anything that may have happened to this body around the time that they died that's going to help you figure out more information about the cause and manner of death. So this is a time where in your notes you might want to grab a separate sheet of paper, put a title at the top that says death-related phenomena, and then put a line down the center. And over on the left-hand side, make it say clues, and on the right-hand side, make it say what it means, so that you're going to keep track of the different things I'm going to show you, of the different clues that I show you, and then what they mean. For example, as we look over on the left side of this slide, we can see this guy who unfortunately got himself a gunshot wound right here. But in addition to the gunshot wound, you can see all of these tiny little spots here. So these tiny little spots, these little polka dots, are called stippling. And stippling is just a fancy word for gunpowder that came out of the gun and was really very hot, and it was still burning and hit this person's skin. And it hit the person's skin and caused these burns to happen on the person's skin. That stippling, or that polka dots, those polka dots tell us that the gun was close enough that while those little tiny pieces of gunpowder were still burning, they hit this person's skin. So if this gun had been up closer, the gunpowder wouldn't have had a chance to spray out and give us these polka dots. If the gun had been farther away, then when those spots of gunpowder spread out, they would have cooled off before they hit the skin and not left these little burns. So this tells us that this was a close gunshot wound, but not a contact gunshot wound. So if you see stippling, or these little polka dot burns caused by this burning gunpowder, that tells you you've got a close gunshot wound, but not an actual contact gunshot wound. Over here, if we're looking at cuts on the insides of their arms or on the insides of the person's hands, if you're looking at those kinds of cuts, that tells you that you've got defense wounds. That's a victim trying to defend against himself or herself. Think about the position you would put yourself into if you were fighting off an attacker. You're probably going to put your hands up in front of your face so that the insides of your forearms are facing out, and that's how you get those cuts, is because the attacker is coming at you. So if you're seeing cuts on the insides of the arms, the insides of the forearms, or the insides of the palms, that's probably a defense wound. So another thing we're going to look at in the body is rigor mortis. And rigor mortis is the stiffening of the body after death. And that happens because the membranes of the muscle cells are more permeable to calcium ions, and that means things are just going to stiffen up. And we'll talk a lot more specifically about rigor mortis later. I just want to get you the basic information. So rigor mortis starts between 2 and 6 hours after death, and it's going to stay for 2 to 3 days. And after 2 to 3 days, the muscles are going to start to relax again. And the reason the muscles start to relax is because decomposition is going to begin. How fast rigor mortis sets in and how fast rigor mortis leaves is going to depend on the activity the person was doing before they died, and then the ambient temperature. And ambient temperature just means what's the temperature of the atmosphere around this person. So is it really cold where they are? Is it really warm where they are? Those things are going to impact rigor mortis. There are a bunch of other things that will impact the speed of onset and the speed of going away of the rigor mortis, but those are the biggies for now. All right, sorry about the baby picture. Livor mortis, or I've heard some people say liver mortis, but I like livor mortis. Livor mortis, or postmortem lividity is another way of saying it, is the settling of blood due to gravity after the heart no longer circulates it through the body. So blood settles, blood is going to stop getting circulated by the heart. Blood is just going to sit in your blood vessels. And at a certain point, those blood cells are going to start to basically leak between the cells that are causing those that are forming those arteries. And that blood is just going to settle down to the bottom of the body. So wherever the body is positioned, whatever point is lowest, blood is going to settle down there. That's going to give you this purplish reddish discoloration of the skin. And lividity is going to set in about an hour after death. And it's going to peak in 3 to 4 hours. And at that point, it's going to become fixed. We say lividity is fixed. And that means it's just going to stay. And that's where the coloring is going to be. And the reason lividity is important is that it can tell us if the body has been moved or not. So as we look at this poor little baby, we can see all of this purplish red discoloration on this leg. You can see it over here. You can see it over on the back. And then you can see some up toward the back of the head. And you can see it here as well. So that tells us that this baby was face down, was on its back for about 3 or 4 hours after it died. Now, you might see these white spots and be confused by these white spots and be all, hey, what's the deal with that? Those aren't purple, so why isn't the blood there? Those are the places where the body was touching the surface it was lying on. So in the pressure points, you basically create a slightly higher spot, and the blood is going to flow down from that slightly higher spot. And so blood isn't going to collect in those spots. So where you see these white spots here, and then back here on the back of his leg, those are the spots where the body was touching the bed or the surface, whatever it was laying on. This guy over here he is getting picked up at the scene. Here he is on the tray on the autopsy table, and you can see that he had his arms across his body. This guy died, or at least was lying on his stomach after he was died. So he died face down, or he was lying on his stomach. At least he was face down after death for a few hours until lividity became fixed. And you can tell that because, again, this purplish discoloration is here on the front. It's not on the back. You can also see these white spots, which is where his arms were. So notice that they match up to where his arms were. You can see here there was probably something underneath him when he was lying. And then you can see all of this. This is probably where his shirt was pushing up, was probably kind of bunched up. And then he was lying. His stomach was the thing that was pressing onto the floor or whatever surface he was face down on after he died. So another clue that can help you out is if you look inside the eyes. So in the external examination, you're also going to want to lift up the eyelid. I know this is a gross picture. Lots of people are way more traumatized by this picture than they are by the dead baby. And there are these things called petechiae. And petechiae are little pinpoint hemorrhages. They're tiny little spots where blood vessels have burst. And you'll see them in the eyes. You'll see them in the lining of the mouth and the throat. And they're also called Tardieu spots. What they indicate to you is that this person asphyxiated. You might need to look up how to spell asphyxiated, or I could tell you, but I won't. So go look it up, asphyxiated. This person asphyxiated, which means that they suffocated. So it may be because of strangulation. It may be because oxygen was cut off in some other way. So if you see these little polka dots, that tells you that this person asphyxiated. So that would be a great thing to put onto your death-related phenomena sheet. So you put in, if you see petechiae, which are tiny little pinpoint hemorrhages, that indicates that this person asphyxiated. I hope this next section isn't too traumatic for you. Traumatic death. So the trauma that's involved with death can fall into 4 categories. There's mechanical trauma, chemical trauma, thermal trauma, or electrical trauma. Mechanical trauma, here's a fancy definition, occurs when the force applied to a tissue exceeds the mechanical or tensile strength of that tissue. So what that means is you're just applying a force that's too strong and that tissue can't hold up. So typically we're talking about like skin and muscle here. So if we've got a tear in the skin or we've got a cut in the skin, that means you've applied more force to that skin than that skin can hold up to. There's sharp force trauma, which refers to injuries that are caused by sharp implements. So obviously sharp force trauma comes from sharp things. One of the clues that you'll see is that if you see a wound that's deep or that has really clean edges, so a deep wound with clean edges, that's going to be sharp force trauma, most likely. So deep with nice clean edges, if you see that, that tells you you're looking at sharp force trauma. So some really sharp implement caused that. An interesting thing when you're looking at cuts is that, or you're looking at stab wounds, is that the hole left behind by the implement is actually going to be slightly larger than the implement itself. So when the knife came down into this area of the skin, the knife came straight down, the cut was exactly the same as the knife. But as this person, as anyone, pulls the knife out, there's going to be a slight backward motion. And that slight backward motion, and it's tiny, we're talking about itty bitty, not even noticeable if you're looking at it. That slight backward motion is going to create a slightly bigger wound. And so if you look, if you were to put that knife back into the wound itself would actually be slightly bigger than the knife. The alternative to sharp force trauma is blunt force trauma. And blunt force trauma refers to injuries that are caused by dull or non-sharpened objects. So we're talking about like if you're hit with a baseball bat or a golf club, if you're in a car accident, you bang up against the windshield or the dashboard, that's blunt force trauma. So whereas blunt trauma is going to produce lacerations or tears in the tissue. So these aren't cuts, these are tears. So they're going to have jagged edges and they're going to be shallower. So again, but over on your death-related phenomena, if you find breaks in the skin that are shallow and have tears, have jagged edges, that tells you you're looking at blunt force trauma. So sharp force trauma commonly causes death from a loss of blood. And remember, our fancy word for loss of blood is exsanguination. Blunt force trauma commonly causes death from brain contusion or accumulation of blood in the tissues outside of the normal blood vessels. So those are hematomas. They're basically blood tumors is what that means. An extreme contusion or a hematoma is a blood tumor. That's a bunch of blood that is where it doesn't belong and it can cause problems. Now, it's of course possible to have sharp force trauma and blunt force trauma that don't kill you. We've all had sharp force trauma and blunt force trauma. So we had blunt force trauma when we were riding our bikes and we fell off our bikes and we banged our knee open. Sharp force anytime you were in the kitchen and you were cutting something and you sliced your finger open. And in fact, I guess even a paper cut would probably count as sharp force trauma because you've broken the skin, you've applied a force that breaks the skin. So just understand that these aren't necessarily causes of death, but they can be causes of death. Interestingly, a gunshot wound is actually blunt force trauma. And that makes sense if you think about it, because think about those bullets that we passed around way back in the ballistics unit. They weren't sharp. Nobody was in danger of, oh, I'm going to cut myself on this bullet. That was blunt. The issue is it's just getting shot really, 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 really fast. And so the speed is making it able to have the force to break your skin. So chemical trauma is just interactions of chemicals with the human body. So if we're talking about poisons, that's chemical trauma. Thermal trauma, we're talking about temperature. Hypothermia, hypo means under or less than. So hypothermia is too much exposure to cold. Hyperthermia is too much exposure to heat. So hyper is too much. So if you think about somebody who's hyperactive, that means they're active too much. So hyperthermia is too much heat. Hypothermia is not enough or too much cold. Typically, sick people, people who are already sick from something else, people who are elderly, or people who are really, really young are the most likely to succumb to hypothermia or hyperthermia. That's why in the dead of winter and in the really, really hot parts of summer, people will say, go check on your loved ones, especially the elderly, especially children, people who might not have air conditioning or heat. Thermal burns are going to be more localized. So thermal trauma, if you burn yourself on a pot, that's thermal trauma as well, but that's going to be more localized. That's not going to be the entire body. Interestingly, people who die in a fire generally die because of asphyxia or lack of oxygen. It's the lack of oxygen that kills them. It's not the burning. The burning itself doesn't kill them. It's the lack of oxygen and they suffocate. The other thing is the carbon monoxide. So the inhaling the carbon monoxide poisoning from the fire can also do it to you. True thermal deaths, so a real hypothermia or hyperthermia, is going to happen because you've got massive tissue damage or because you have a swelling of the airway that's going to keep somebody from being able to breathe. Finally, electrical trauma. Electricity can cause death in a bunch of different ways. So ventricular fibrillation is a thing, and what that is it's a random quivering of the heart, and that makes it so that the heart can't pump the blood through the body properly. So if you get electrocuted, your heart is running on electricity already. If you get electrocuted, you're shooting different electricity into your body, and that electricity disrupts the electricity of your heart already. The heart can then get pushed into what's called tetany, and tetany is a sustained contraction. So your heart is normally contract, relax, contract, relax, contract, relax, contract, relax. Tetany is a sustained contraction. So it goes contract, and then it stays there, and the only way that tetany gets broken is when the circuit is broken, so when the electricity stops. All right, so continuing on with other parts of the external examination, you're going to want to collect swabs. Remember, way back in the evidence section, we talked about all the different swabs that are going to have to be taken. So just, some of the main ones, they're actually swabs that could be taken from all over the body, but the main ones are vaginal, oral, rectal swabs. Those are going to be taken so that you could submit them to the forensic or tox lab. You're going to take one set for smears, and that means that they're going to take the swab and they're going to smear it across a slide so that they can go look at it under the microscope to examine for sperm, for example. And then you need other sets for serological examination. So if you're going to want to do a blood typing test to see if the person's a secretor, find out what their blood type is, or if you're going to want to see if there's any DNA in there, you're going to need sets for that. So it's not just one swab in each place, it's multiple swabs in each place. And then remember that you also need to take head and pubic hairs from the deceased person because those are your knowns, those are your exemplars. So if you find hairs on the clothing, for example, you need to be able to compare them to say, oh, this is this person's own hair. Or this is, if you're if you're looking at the underwear, hopefully you're not in their underwear. If you're looking at the person's underwear and you find hairs in the pubic hairs in the underwear, you're going to want to know, did those come from this person or did they come from possibly somebody who violated this person? Another thing you might look for is ligatures or victims bindings. We've talked about ligatures a little bit when we talked about the enzyme ligase, actually. And ligatures are going to be those binding marks that might be around somebody's wrists, maybe around their ankles, maybe around their neck, maybe around their waist if they were, tied up in a certain way. And so you're going to look for bruising or scraping that shows you that this person was tied up. You're going to want to photograph them. You're going to want to sketch them. You're going to want to collect them. As a side note, if the person actually has a ligature on them, remember that if it's tied, you don't want to cut at the knot. You don't want to untie the knot. You want to cut away from the knot because the knot itself might give you some evidence. You need to take a full set of fingerprints to be referenced against any databases. Again, we're not going to identify the person just based on someone's opinion. People are wrong. Even somebody's mom can be wrong about them being that person. They could be so traumatized that they're like, oh my God, that's totally not him, and it's because they're in denial. Or they could be so traumatized that they're like, oh yeah, that's totally her, because they just want it to be over with. If you have really badly decomposed remains, then you can use the jaw, and then if you've got old dental records, you can compare the jaw to the dental records and maybe identify who the person is. All right, once you're done with the external examination, so that was all on the outside, then you can get to the inside. And on the inside, you're going to look at the internal organs, you're going to remove them, and you're going to analyze them. The standard way to get to the organs, the standard way to do an autopsy is using what's called a Y incision. I'm going to show you a picture of a Y incision after it's been opened up and then sewed back up again, but it perfectly makes sense. So the Y incision obviously starts at the tops of the two shoulders, comes down at about the sternum, and then goes straight down to the belly, through the belly button. So it makes the shape of a Y, hence the name the Y incision. Yes, this is what it looks like after they sew up the Y incision. They don't go to great detailed lengths to give you, good plastic surgery quality stitches. They just need to get you closed back up again. So the stomach is going to be taken out, and the stomach contents are going to be examined thoroughly. They're going to take a look and see if there's big chunks of food, then that means that you ate shortly before death. If there's only really liquidy food or it's almost empty, then that means it's been a long time since you've eaten. Every organ is going to be sectioned or sliced off into pieces, and it's going to be looked at internally and externally to look for any abnormalities. And then you're going to take samples for microscopic analysis of the cells. That's called histology. So histology is looking at the cells under the microscope. And then you're going to take samples for toxicology screening as well. Samples will also be taken for storage, and they get stored in case later analysis needs to be done. So there are little jars of sections of people's tissue that are out there in pathologists' offices that are just waiting in case it needs to be referred back to again. All right, determining post-mortem interval, figuring out how long it's been since the person died. Again, post-mortem, post-after, mortem, death, figuring out how long it's been since the person died. That's based on this idea that we know that certain things happen after you die. So we have studied things that happen after you die, and that's called the post-mortem clock. So we'll look at livor mortis or livor mortis or post-mortem lividity, whatever you want to call it, and we know certain things about that. Remember, we said it's going to set in within an hour or two. It's going to be fixed after 3 to 6 hours. We're going to look at rigor mortis. Again, we've got our time frames on rigor mortis that we know about. We'll check out the body temperature. The body temperature, the cooling of the body, is known as algor mortis. Algor mortis is the cooling of the body. And the cooling of the body is going to start the first hour. The body is going to cool by about 2 to 2.5 degrees. And then that's going to slow down to about 1.5 degrees for the first 12 hours. At that point, ambient temperature becomes important. We'll look at decomposition. We know what happens with decomposition from studying bodies decomposing. Decomposition of the body begins almost immediately. One thing that's interesting is that never mind. I'll hold that interesting thing for later. Autolysis. Autolysis you read about. It's the disintegration of the body by enzymes released by dying cells. Dying cells are so considerate that when they die, they release enzymes that clean up after themselves. So they completely clean themselves up. So autolysis is your body literally digesting itself. Putrefaction, on the other hand, is the disintegration of the body by the action of bacteria and microorganisms. So when other little critters come and clean up after you, that's called putrefaction. There are 4 main steps of decomp. You start out as a dead body, you're fresh, and then bloated, where you sort of swell up and fill with air because all of those bacteria and microorganisms are releasing gases. And when they release those gases build up inside your body, and so your body kind of swells and becomes bloated. Then your body's going to decay, so parts of it are going to go away as autolysis and putrefaction happen. And then ultimately, after long enough, it'll go to dry. So fresh, bloated, decay, and dry. And all of this, but especially decomposition, is dependent upon environmental factors. So whatever's going on in the environment is going to affect all of these things. All right, you're also going to look at body fluids and tissues. You might look for changes in the eyes, physiological changes with progression rates. So, for example, you're going to look at the stomach contents, see what's going on in there. How new is this food, or how old is this food? Survival after injuries. Did the wounds have a chance to heal? Did the wounds happen right when you died, or did they happen shortly before? How long did it take? All right, so things that you're going to send for laboratory analysis. Histology, I already referred to, is just looking at cells. So we're going to look for evidence of cellular pathologies, so things that are different in the cells from what we would normally expect. And those cellular pathologies might come from disease, they might come from trauma, they might come from some pre-existing condition we already know about. You're going to take tissue samples with this thing called a microtome, and a microtome makes really freakishly thin, really precise slices so that then you can look at them under the microscope. You might send some samples to toxicology and do a toxicology screen. That's going to test for the absence or presence of drugs and then the metabolites of the drugs in fluids and tissues. You're going to write up your report. Shocking, there's no standard reporting form. But if you're writing a good autopsy report, it's going to include information from the police report. It's going to include information from the medical investigator, whoever the person was who went out to the scene, because the coroner, him or herself, the medical examiner, him or herself, probably isn't going to go out to the scene. Somebody called a medico-legal death investigator is going to go out to the scene, and they're going to have written a report. They may have done some interviews, so you might have some witness reports. You'll go to the doctor to get the medical history of the decedent if you can. You'll have the pathologist's report of the actual nitty-gritty what happened in that autopsy. All of that is going to go together to give this whole report that's going to help you determine cause of death and manner of death and give that information over. All right, you might need to exhume a body. So in the Sam Shepard case, remember they exhumed the bodies. An exhumation is the digging up or removing of a deceased individual from a mausoleum. The thing is that if the body has been embalmed, the embalming might actually have caused damage that would otherwise have helped us. And what embalming is it's what happens when you go to the funeral home and they chemically treat the dead human body so that microorganisms don't grow, so that decomposition gets slowed down, so that there's enough time for people to have a funeral and look at you and not be in that bloated stage. Because if they don't embalm the body, you'll go from fresh to bloated, and then everybody's looking at you in this bloated state at your funeral, and it's gross, and there's bacteria, and there's gases, and it's ucky. So the problem with embalming, though, is that once the body has been released and goes to the funeral home and gets embalmed, that embalming can destroy some evidence that you might otherwise need. All right, and then finally, you might need to consult with some other people. You might need to consult a forensic anthropologist. That would be somebody who's looking at bones if all you've got is bones. You might need to consult an entomologist. That's the bug guy. Here's the interesting thing I was going to say before. Blowflies land on your body, and they actually know you're dead before you know you're dead. So blowflies are there within minutes of death. Within minutes of a body being dead, blowflies are there and they're laying eggs. You might also need to consult with a geologist. Those are the rock guys. Or an odontologist. Odontologists are the teeth people. They're the people who are going to be especially helpful if you're trying to identify somebody based on their jawbone. If you don't have any other identifying information, an odontologist is going to help you. All right, believe it or not, that's the end of these pathology notes. There will be more death-related phenomena that I will show you. That's where it gets kind of cool in a gross kind of way. But we're going to save that for a little bit later. Until then, you need to study. There is lots of information here, so get on it.